Artificial Intelligence Dr. www.abcpharma.net User question: what are the physiological characteristics of the heart of a patient 70 years old with a single-chamber leadless pacemaker, no AV synchrony, who can swim 25 meters butterfly in 20 seconds and row 5 kilometers in 50 minutes with a heart rate of 75 beats per minute while the setting of the pacemaker is 50 beats per minute? ChatGPT-o1 answer: thought for 12 seconds. The 70-year-old patient in question has a single-chamber leadless pacemaker set at a basal rate of 50 beats per minute, BPM, and he lacks atrioventricular, AV, synchrony due to the pacemaker's configuration. Despite this, he can perform vigorous physical activities, swimming 25 meters butterfly in 20 seconds and rowing 5 kilometers in 50 minutes, with a heart rate that increases to 75 BPM during exercise. This scenario provides insight into several physiological characteristics of his heart: preserved sinus node function and chronotropic competence. Intrinsic heart rate increase: the patient's heart rate rises from the pacemaker's set rate of 50 BPM to 75 BPM during exercise. This indicates that his sinoatrial SA node, the natural pacemaker of the heart, is functional and capable of appropriately increasing the heart rate in response to physical activity. Pacemaker dependency: the pacemaker is not overriding his intrinsic rhythm during exercise. Instead, it serves as a safety net, activating only when his heart rate falls below 50 BPM. This suggests intermittent bradycardia or periods of sinus node dysfunction at rest, but with preserved chronotropic response during exertion. Lack of AV synchrony with compensated hemodynamics: no AV synchrony. The absence of AV synchrony means the atria and ventricles are not contracting in a coordinated fashion. In many patients, this can lead to reduced cardiac efficiency because the atrial kick contributes to ventricular filling. Adequate cardiac output: despite the lack of AV synchrony, the patient maintains sufficient cardiac output during intense exercise. This implies that his ventricles have good compliance and can fill adequately without coordinated atrial contraction. Compensatory mechanisms: the heart compensates for the lack of AV synchrony through increased stroke volume and heart rate. The patient's ventricles may have enhanced diastolic filling properties or stronger contractility to maintain performance during exercise. Good ventricular function: efficient ejection fraction. The ability to perform strenuous activities suggests that the ventricles are pumping effectively. The ejection fraction is likely within normal limits, allowing for adequate oxygen delivery to the muscles during exercise. Physical fitness: the patient's capacity for vigorous exercise at 70 years old indicates a high level of cardiovascular fitness, which can mitigate the hemodynamic disadvantages of lacking AV synchrony. Possible conduction system disease: underlying AV node dysfunction. The need for a pacemaker suggests that the patient may have an underlying AV block or bradyarrhythmia that prevents reliable transmission of impulses from the atria to the ventricles at rest. Intermittent conduction: during exercise, sympathetic stimulation may enhance AV node conduction temporarily, allowing intrinsic heart rates above the pacemaker's set rate. Autonomic regulation: sympathetic activation. Exercise induces sympathetic nervous system activation, increasing heart rate and contractility. The patient's heart responds appropriately, indicating intact autonomic regulation. Lack of pacemaker rate responsiveness: since the pacemaker is leadless and single-chamber without rate-responsive features, it does not adjust the pacing rate during activity. The observed heart rate increase is purely due to the patient's intrinsic mechanisms. Summary: the patient has preserved SA node function with an appropriate increase in heart rate during exercise. Despite lacking AV synchrony due to the pacemaker, he maintains adequate cardiac output through compensatory increases in stroke volume and heart rate. His ventricular function is robust, allowing for effective performance during strenuous activities. There may be underlying AV node dysfunction necessitating the pacemaker, but autonomic regulation during exercise remains intact. Implications for care: monitoring. Regular follow-up is essential to monitor pacemaker function and adjust settings if necessary. Exercise recommendations: the patient can continue physical activities but should be aware of symptoms like dizziness or fatigue that may indicate inadequate cardiac output. Potential for upgrades: in the future, upgrading to a dual-chamber or rate-responsive pacemaker could be considered to improve AV synchrony and exercise capacity further. Claude AI answer: let me analyze this interesting physiological scenario step by step. Patient profile: 70 years old, has a single-chamber leadless pacemaker, likely ventricle only, no AV synchrony present. Base pacemaker rate: 50 BPM, can perform high-intensity activities. Athletic performance assessment: 25 m butterfly in 20 seconds, impressive speed for age, 5 km rowing in 50 minutes, strong endurance, heart rate during rowing, 75 BPM, relatively low for exercise. Key physiological implications: intrinsic heart function: patient likely has good intrinsic heart rhythm above the pacemaker's base rate. Native SA node function appears intact, evidenced by rate greater than 50 BPM during exercise, demonstrates chronotropic competence, ability to increase heart rate with exercise. B. Cardiovascular fitness: exceptional cardiovascular conditioning for H. Well-developed stroke volume and cardiac output. Strong ventricular function, needed for high-intensity butterfly stroke. C. Compensation mechanisms: despite lack of AV synchrony, the heart has adapted to maintain good cardiac output. Likely increased ventricular filling through Frank-Starling mechanism. Possible enhanced peripheral oxygen extraction. Unique aspects: the relatively low exercise heart rate, 75 BPM, during sustained rowing suggests very efficient stroke volume, well-developed arteriovenous oxygen difference, excellent peripheral vascular adaptation, strong muscular endurance. Would you like me to elaborate on any of these aspects or explore additional physiological characteristics? Gemini AI Advanced answer: this is a fascinating case. Here's a breakdown of the likely physiological characteristics of this patient's heart, keeping in mind that we can only infer so much without a full medical workup. Key points: age, 70 years old. This means the heart has undergone some age-related changes like increased stiffness and potentially some degree of fibrosis. Single-chamber leadless pacemaker, no AV synchrony. This pacemaker paces only the ventricle, meaning the atria and ventricles are not contracting in perfect sync. This can slightly reduce the heart's efficiency. High level of physical activity: this patient is incredibly fit for their age. Swimming, butterfly and rowing long distances require significant cardiovascular output and endurance. Likely physiological characteristics: good intrinsic heart function. Despite the pacemaker and lack of AV synchrony, the patient's heart can clearly keep up with high demands. This suggests their underlying heart muscle is strong and capable of generating a good stroke volume, amount of blood pumped per beat. Effective chronotropic response: even though the pacemaker is set to 50 BPM, the heart rate reaches 75 BPM during exercise. This indicates the heart's natural pacemaker, the sinoatrial node, is still somewhat functional and can respond to the body's increased need for oxygen. Efficient cardiac output: to sustain these activities, the heart must be pumping a large volume of blood per minute. This is achieved through a combination of stroke volume and heart rate. Potential for some degree of cardiac remodeling: years of exercise may have led to some physiological changes in the heart, such as an enlarged left ventricle, the main pumping chamber, and increased blood vessel diameter. This is generally considered beneficial. Possible underlying heart condition: the need for a pacemaker suggests an underlying issue like bradycardia, slow heart rate, or heart block. However, the patient's high level of function indicates this condition is well managed. Important considerations: lack of AV synchrony. While this patient is doing well, the lack of AV synchrony could limit their peak cardiac output. In some individuals, this can lead to symptoms like fatigue or shortness of breath during intense exertion. Pacemaker dependence: it's important to know how much the patient relies on the pacemaker. If their intrinsic heart rate is very low, they might be more susceptible to issues if the pacemaker malfunctions. Overall health: factors like blood pressure, lung function, and muscle health also contribute to exercise capacity. In conclusion, this 70-year-old patient demonstrates remarkable cardiovascular fitness despite their age and pacemaker. Their heart appears to be strong and adaptable, with efficient pumping capacity. However, the lack of AV synchrony and the underlying reason for needing a pacemaker are important factors to consider when assessing their overall cardiac health.